Welcome to Beyond the Paper Gown, where we explore healthcare innovations that are changing lives. I'm your host, Dr. Mitzi Crockover, and today we're diving into a topic that touches all of us, mental health. We're privileged to have Dr. Sarah Adler joining us for our discussion. She's a visionary who's working to reshape mental health care in America through technology and evidence-based approaches. As founder and CEO of WAVE, Clinical Associate Professor of Psychiatry at Stanford University School of Medicine, and the author of the DBT Solution for Emotional Eating, Dr. Adler brings a unique perspective shaped by her background as both a clinical psychologist and former hedge fund analyst. Yes, you heard me correctly. Stay tuned to hear the details. We'll talk about how tech is making therapy more accessible and personal. You'll hear about work-life balance and practical tips for everyday well-being. So whether you're dealing with stress yourself, and who isn't, or supporting someone who is, today's conversation has something for you. Let's get started as we explore the exciting crossroads of mental health, technology, and compassionate care. Sarah, thanks so much for being with us today.
Thank you so much for having me. I've been looking forward to this conversation all week.
Terrific. So let's talk a little bit about kind of the origin of WAVE and your journey as a psychologist from maybe clinical practice to technology and the intersection of the two.
Sure. So my background is even more varied. I'm actually a former hedge fund analyst. That's what I did.
That's right.
Before I even became a clinical psychologist. And I found not only was I not super great at it, but it was definitely not aligned with my values of helping make the world a more livable place. I went back to school and became a clinical psychologist. I was lucky enough to do my work at Stanford, where the focus on evidence-based care and really disseminating things into the world that work was a great fit for what I wanted to do. And then ultimately, I was pregnant with my second child, and I was doing a postdoctoral fellowship that really opened my eyes to delivering care in new and innovative ways. So I was lucky enough to learn user-centered design and to learn how to use and think about the healthcare system as a whole to try to design ways to deliver care that can align the incentives of everyone involved, from the people, the patients, to the clinicians who are providing the care, to the people who are paying for the care.
So give us a specific example of how WAVE interacts with the individuals that they're serving.
Yes. So we are what is called a stepped care model. And we are a digital entry point, which is kind of where the system is going. And we use predictive analytics and a bunch of questions and data to find out a little bit about who you are. And then we run through our predictive analytics. These are algorithms that I developed in my research lab at Stanford to really understand who needs what care at what time. I'll give an example: an 18-year-old girl who has just been rejected from the Ivy League college of her choice, which has triggered an onset of depression. We're going to think about that in one way based on her biology, her psychology, her social place in the world, her genetics, et cetera. If I have an 18-year-old woman from East Palo Alto who's coming in, who lives in the middle of a food desert, and her depression is triggered by not having enough nutritious food to eat and living in a world where there are gunshots all around, that's going to be a very different presentation. And I think our model, our medical model right now, treats those two people the same way by labeling them both as someone with major depressive disorder. But we really have to kind of take a step back and look at all of the different ways that people are different and presenting differently. And that's really what our algorithms do, is they collect information on what we call social determinants of health, family history, what's happening in your life. We feed that into our algorithms and we make a determination of what evidence-based treatment is the right pathway for you.
Does that also include types of therapy as well as medications?
Absolutely. So we apply what is called a transdiagnostic model, which basically is a really super geeky way of saying we don't care what your diagnosis is, because although the insurance company does, and we need to bill for a diagnosis, we're looking at kind of the next three layers beyond the diagnosis at these other factors that are sort of presenting as major depressive disorder. So we pull from all of the different therapy modalities that have a strong backing in science, like cognitive behavioral therapy, dialectical behavior therapy, acceptance and commitment therapy, even some psychodynamic object relations things, anything that has science behind it.
My understanding is that you provide this service to employers and to institutions for their employees. How do you ensure privacy? And is there any interaction between you and the employer with respect to specific individuals?
We are a healthcare company. We talk about ourselves that way. And so we never report on individuals unless the individual requests it and would sign a release of information. But the data security question is a really fascinating and interesting one, because there is a lot of value we think we can give to employers at the aggregate level, or sort of by looking at all the data across their company and being able to customize reporting based on things like geography, or based on cross-functional sections. So if we, for example, see in terms of predicting risk, if we start to see the mood or the mental health statistics plummet in one organization, and we can see that it's happening across 90% of the people in that small subset of the organization, we can say, like, hey, there might be a problem here that you might need to address that's systemic. Maybe there's a manager, maybe there's something going on that we don't know. So we do share data in that way at a very high level. And also, of course, that's very relevant in terms of a company being able to predict downstream healthcare costs, because as we know, mental health and physical health are so interconnected. Finally, the world is starting to accept that as a reality. And so we are able to sort of help companies improve their bottom line and demonstrate a return on the investment that they're making in our solution, but never on an individual level.
Sure. And do you have any specific outcome data on your program?
We do. We actually think this is one of the things that highly differentiates us in an incredibly crowded marketplace. There are so many mental health solutions out there. I'm a scientist first, clinician first. The second thing that I did when I started this company was applied for an external IRB, or an institutional review board, so that we could collect data and have that data peer reviewed. And we did just that. So we've been the folks who elect to be in our studies, which is most of the people on our platform. We collect outcomes data on them, and we have shown we not only were able to collect 75% of the folks who come onto our platform give us outcomes data, which is unheard of in this space, but what we have demonstrated is that we're able to reduce depression, anxiety, stress, as well as a myriad of other issues. And the question is, how do you maintain that across, right? And so we need to kind of look at those data and make sure that we can maintain and keep people in a healthy way. But that's sort of the beauty of our product, is that because the most expensive or the resource intense part of our model is the human interaction, we really do cultivate a relationship using the app and the human being, so that when someone is finished with their 8 to 16 sessions, they're really integrated with using the tools on the app, which can help maintain their gains, their treatment gains. And then only when they need it can they come back into the system, and we can help them figure out when that is based on our predictive analytics and using the data that they're giving us.
Sure. Have you been able to also track any of the ROI that you mentioned earlier?
I'll give you a geeky answer. Yes, we have really good ROIs. They can be up to 6x with some of our corporate partners. And of course, it's dependent on variables like how big is your company, what is the industry your company is in. But usually we see an ROI between 2x and 6x for our employers.
And for our audience, explain what that means.
So ROI means return on investment. So it means the amount of money that you are paying for our solution, you need to be seeing that that's worth something to your company. Really, what we're saying is that you are making back in cost savings associated with downstream healthcare costs. So what we're saying in a nutshell that is, if you pay for our solution, for your employees who are going to cost you a lot of money by not showing up to work because of mental health issues, a loss of productivity because of mental health issues, downstream medical costs, emergency room costs, chronic disease, which is highly associated with mental health, behavioral health. We're going to save you a lot of money for the amount of money that you're giving us. So we're a good deal.
No, thank you for doing that. That's great. Segueing a little bit into just kind of the technology area, you've obviously worked as a clinician and you're now leading a tech-enabled mental health company. What unique capabilities are there with technology? And you've kind of highlighted them a little bit previously that traditional therapy can't provide.
Your question's a really good one, is what is sort of the secret sauce? And that really is in the measurement-based care piece of this. So measurement-based care means collecting data on how the patient is doing, collecting data around how the clinician thinks the patient is doing, and using that data to inform and guide the treatment. It helps the clinician really focus the care. It prevents something we call therapist drift, which is it keeps the therapy in an agendic format. It focuses the therapy on what the problems really are. So I think technology, it's not a question of what can technology do that therapy can't, but how can we as therapists use technology to inform our work so that we can get people doing the work on their own as quickly as possible, because that's really what they want. And fundamentally, as a therapist, what I want to do is not foster a dependency on me so that the patient has to be with me forever. I want to get them out into their daily lives as quickly as possible so they don't need me. And that, from a business perspective, just means it opens up a slot for another person. And it also really helps the patient see if they're making progress in a way, just the same way that if you're using a step counter or an Aura ring. It gives us information. It gives us data that we can then use and apply to see, are we moving in the direction we want to be moving in?
Well, let's shift a little bit and talk about some of the specific mental health issues that perhaps you've seen in either your clinical practice or with WAVE with respect to women. What health patterns or mental health patterns do you see as women kind of navigate the different phases of life?
Oh, and this is a huge one. I think we could talk about this almost in developmental stages. I could talk about what the patterns I see with adolescents. I can see different patterns with 20 to 30-year-olds. We get our postpartum women. And then, of course, what I'm really seeing, and I think the big sort of hot topic that everyone is talking about right now in the best way is perimenopause and menopause, which is, in my mind, the most exciting place to be working right now, just because we're finally starting to have conversations about it, which is spectacular, amazing, and hopefully will actually promote real change. It is truly amazing how many people we see coming in for mental health services around the age of the perimenopausal age. And these are symptoms that are, although they are hormonal and they're very physiological, we see a lot of coping issues, like why I'm not sleeping, insomnia. We see depression, or on the other side, like acute anxiety. We see all of these things that we would generally classify through the lens of usually behavioral health or mental health. But therapy is actually not going to solve those problems without actually taking a physiological approach. So a lot of times I found myself really assessing what's going on, but I've also been trained to always look to see and rule out if there's any sort of physiological underpinning, or if there's something physical that's actually happening, before I start to jump in and do therapy on someone who actually may need hormone replacement therapy or
Mhm.
something else. So I try to take these folks and send them off to really have assessments on whether or not their hormones are imbalanced, but also working on behavioral issues to support like increased communications. Our hormones also can exacerbate existing mental health conditions that are already there, and we see them spiked. So making sure that they're getting the hormonal help that they need, and as well as getting that sort of coaching and that support that they need around behavioral changes that they need to make as they figure it out. So that's kind of where I see our place there.
The other piece is I think about, again, women who are working especially, that they and we have, multiple roles, whether it be caretaking our children, caretaking our parents, doing both, working and all of that. And so talk a little bit about how women can juggle all of that and still keep up their resilience and their balance.
I think as long as women like us are setting the expectations on ourselves to do everything perfectly, we will be fighting a losing battle. And one of the things I've learned as a CEO and also as a clinician is that like disciplined, vigilant prioritization is key. Understanding, and this translate into tools that you can use, is what are your values? What are the most important things to you in any given moment? And acknowledge that those things might shift over time. So we have in our app something called a values clarification exercise that addresses just this, which is understanding that I might have 5 core values: family, career, I don't know, spirituality, money, I don't know, pick yours, and vigorously assess them, and where they're stack ranking at any given point in time. And this might change based on the system around you. For example, a lot of the time, my value of career and making sure this company works is at the very, very top of my stack rank. But my daughter got sick at the end of last spring in a way that was going to prevent her from being able to start her freshman year in college. And I can
Mm,
tell you that that stack ranking had to shift. And I had to give myself compassion around having that stack rank shift. And I had to be really clear in communications for those people around me. So instead of trying to pretend that those things were equally important and trying to do both perfectly, I reassessed what my values were and then communicated out to the people around me so that I could hopefully get the support that I needed to take care of what I needed to take care of that was at the top of my list, because oftentimes our values conflict. And so it's that diligent, hardcore prioritization and compassion for that it's going to move around. Depends on where we are in our lives.
sure. That was a big choice, especially as a CEO of a company. And I wonder though, any advice for individuals who are employed and may have to make those choices and how to deal with them, and how have you been able to communicate with employers about some of this, in order to support those employees?
We tend to communicate with our employer partners that your employee's mental health is not an individual problem. It is a systemic problem. It is a systems problem. And when your employee is suffering, there are certain things that you can do to support them, which is one, hook us up with them, and we'll try to take care of the individual piece, but also do a reevaluation of what's happening and where are the levers that you can pull systemically. Because if one of your employees is suffering, there are probably others of your employees that are suffering as well.
And has that translated into specific programs? I'm thinking, or policies with respect to perhaps caregiving or even menopause, as we've just talked about.
Yeah, so I think that what some of our sort of aggregate reporting back to the employers can really help them identify places on a population level where they can institute specific programs, where they can examine their benefits, they can make things approachable. There are actually some great companies out there who who do caregiver support, who do menopause support, all of these things. And our data really does help pinpoint, again, from a population science perspective where those levers might be, and we take that very seriously. That's why collecting the data is so important. It's also part of the value that we can provide to the employer.
Absolutely. Going back to some of the issues, specific issues for women, for our audience, sometimes we just think about, oh, we're just stressed or, have the blues. What are the signs and signals for someone who it's more than that and that they should really get help?
Yeah. So I think one of the things, I actually think everyone should get help proactively. I think part of the problem with mental health is actually that we look at it as a what we call an acute phase problem, meaning it has to get so bad that we need to then enact the help cycle. The reason my company is called WAVE is because we reject that idea wholly, and we believe that mental health is like a wave, like a sine wave, and it happens on a continuum with peaks and valleys at different points in your personal timeline. And so we would argue that you should be engaging in preventative measures. You should be engaging in things that you can do for your mental health on a daily basis. That could be sitting with a cup of tea for 5 minutes and just taking 5 minutes for yourself, right? It could be as small as that. But when, to your point, when it gets so bad that it is interfering with your values, your ability to act on your values, your activities of daily living in a way that is causing you distress, that is when it is time to really make sure that you are supporting yourself with appropriate care. But I think it's really important to understand that resilience is not something that's built when the poop hits the fan. It's something that is actually developed incrementally before we get to that point. And that can be hard because many, as you said, women have so many hats that we're all wearing. No matter how pretty the hats are, there are so many hats we're wearing, and we want to be wearing all of those hats. But fundamentally, juggling all of that puts us on a precipice. So that if something goes wrong, if we don't have that resilience really, really built up, things are going to get bad. And again, what to look for there is when our activities of daily life, when the things that are most important to us are becoming burdensome, are devoid of joy, are becoming impossible to do, or are causing us distress.
Thank you. I want to shift a little bit and just talk about the issue of obesity and emotional eating. You wrote a book about it, and you talked about DBT, or dialectical behavioral therapy. First of all, let's talk about what that is. We'll start there, and then we'll go a little bit deeper.
Yeah, so DBT, which I've been intensively trained in, is a form of cognitive behavioral therapy, which basically means that, hey, there's a really big connection between the things we think and the way we behave and the way we feel. So that's really what cognitive behavioral therapy is in a nutshell. Dialectical behavioral therapy, it incorporates some Eastern philosophies like mindfulness, which we know has 3,000 years of scientific data to support that it works. It incorporates mindfulness very intentionally. And it's kind of this idea, going back to talking about the idea of compassion and self-compassion, that really the only way to make change is to truly accept ourselves as we are. This is sort of a heady concept, and that is the core of dialectical behavior therapy. If you are so busy running around trying to make change from a place of judgment and from a place of self-hatred, you will never actually get there. You'll never be able to do it. And so the idea is to really cultivate an acceptance for our situation, our system, where we are, who we are, where we've come from. And only then, when we really treat ourselves with a lack of judgment and in a non-judgmental way and with self-compassion, can we see the change we want to be in the world.
Talk a little bit about emotional eating and binging and how that therapy addresses those issues.
Yeah, the reason my colleague and mentor, Deborah Safer from Stanford, and I thought dialectical behavior therapy was such a fantastic fit for eating issues in general. And I will say not obesity necessarily, because that's a biological disease. Okay. But the eating patterns that maladaptive eating patterns, overeating patterns, is because there is so much shame involved. And I think this is kind of irrespective of whether or not you have a BMI of 18 or you have a BMI of 60, is that, and women especially really struggle with guilt and shame around eating too much or eating past the point of control. And so based on what I just described about dialectical behavior therapy, it's really if we can kind of simultaneously accept really truly where we are and why we're engaging in the behavior we're engaging in, that in itself, and if we treat that with love and self-compassion, that will allow us to make different choices. And so to put this in a very concrete example, I'm going to describe a circumstance of for someone who really struggles with binge eating, if they have a fight with their spouse and their emotions are kind of through the roof, they're upset, they then will go and try to make themselves feel better. By eating a bag of potato chips,
Right.
by whatever they're eating, whatever their food balm of choice is. And that immediately in the short term makes the uncomfortable physical feelings associated with guilt and shame go away, but only for a moment. So it makes them go away, sort of similarly to an addiction model. But then the feelings come flooding back in the long term, which then sort of perpetuates the cycle. So it never really allows them to deal with the underlying feelings, the emotional distress that they have from when they get into an interpersonal conflict with someone. So that's an example of the cycle. And what dialectical behavior therapy does is, at first, from a mindfulness perspective, allows us to take a step back and look at these behavior patterns and how they're functioning, and then create moments where they think that they can intervene by teaching them skills. So potentially saying, wow, I really have a right to be upset, because a lot, especially of women, when we are emotional and we have intense, strong feelings, we have been told from childhood that that's wrong, that's bad, that's invalid, that our feelings are too much. And so we internalize that narrative, tell ourselves that. So it's about using mindfulness to identify when that's happening, shifting that dialogue with ourselves, and then potentially creating inflection points where we can make choices that are more in line with our values.
And so you talked about obesity being biologic, and certainly there are a number of people now that are doing the GLP-1 inhibitors because they want to address the weight issue. But I would assume that a lot of those people do have some of those habits with that you just described. So would this work with that for them as well?
I actually am a huge fan of the GLP-1s, having worked with the obese population, people struggling with obesity for almost 20 years. And I think that some of the judgment and vitriol around them, and saying, oh, they promote eating disorders, they further systemic issues of women needing to be a thin ideal. Like, yeah, but it is, we are. That all of that is true. And it is ultimately someone's individual choice if they want to use a GLP-1 to help them on their journey, figuring all of their relationship with their body. I'm a huge supporter of that. So I diverge from a lot of the rest of the eating disorder world in that. I think in a lot of my early research in obesity was around how do you create, because the biological urge, and there is a biological predisposition towards obesity, and then we have the all of the overprocessed foods and everything else that sort of work on our brains like little dopamine hits, and so it's really hard in this world. And the GLP-1s can help turn down that food noise, and give us a window for behavioral intervention. So with really refractory folks who are obese and binge eat, because not all folks who struggle with obesity are binge eaters, but for those who
Right.
do, it's such a powerfully reinforced biological and psychological cycle that it can be incredibly hard to disrupt. But if you can turn down that food noise a little bit, then there's a window of opportunity to make real behavioral change for folks who do have that reinforced emotional eating. So I do think that the two together are powerful.
We'll wrap up by just asking you two questions. And that's, first of all, how do you personally manage your own well-being as a CEO, as a mom, as a wife, as a professional? academic.
I think for me, resilience is really key. And what are the small things that I can do every single day to keep myself very resilient? And those are I'm going to give you my incredibly privileged answer. So I play tennis for 3 hours a week. That is something that is
So exercise.
exercise. And for me, I have ADHD. So that is a like, if I'm not exercising, forget it. It's like I don't take medication for it, but exercise is my medication. I think also that again, not to harp on this, but that rigorous prioritization of what's most important to me in any given week, in any given day, in any given moment is really important. So making sure I'm taking what I call committed action towards my values. So, for example, my connection to my children is so fundamentally important, and I travel a lot and I work a lot. And so how do I cultivate that? My son is a highly competitive Pokemon, the card game player, which is this like crazy geeky game. And he wants to talk about it all the time. So I had to spend time. I learned how to play Pokemon, the card game, so that I could really have something to connect with him on at any moment and any time, right? And the same with my daughter. She is navigating her freshman year in college and is realizing she wants to be an English major. And so I make sure that instead of watching tuning out on Great British Baking Show, I'm reading whatever she's reading. I do that too. I definitely watch Great British Baking Show. That's in there as a coping strategy.
It's so wholesome.
It's so wholesome. It's like an antidepressant. But so she's been delving deeply into The Handmaid's Tale. And so I spent my weekend reading The Handmaid's Tale. And so that, like, again, facilitates a common language. I try really hard to eat in a balanced way. Again, with my ADHD, that's important. And I try really hard to make sure I'm doing one social event every weekend as well, like with a friend who makes me feel good about myself. So those are kind of the things.
Those are great examples and great suggestions. So my last question to you is, what did I not ask you that you wanted to make sure that our audience knows?
Oh gosh, I think especially women need to really treat themselves with tremendous amounts of self-love and compassion, and give themselves a break. There's a psychologist called an object relations psychologist named Winnicott, and he came up with the idea of being a good enough mother. And I love this concept, and I like to ascribe it across everything. As again, our expectations of ourselves as women are that we can do everything, and we can do everything perfectly, and we can't. So really giving ourselves the self-compassion to be good enough in the domains, because generally speaking, our good enough will actually look much closer to perfect than as the rest of the world views us. We're usually our own toughest critics. So really making sure that we're giving ourselves the compassion, the space, the self-love, and really that oxygen mask metaphor, right? That is sort of that trope of like, put your own oxygen mask on first, because that will enable you to do what you want to do, which is take care of everyone else around you.
Great. Well, Dr. Sarah Adler, I know I learned a lot today. Thank you so much for sharing your expertise and your experience. And thank you for being on today.
Thanks so much for having me. This was great.
As we wrap up our fascinating conversation with Dr. Sarah Adler, let's reflect on some key takeaways from today's discussion. We explored how WAVE is revolutionizing mental health care through its stepped care model, using predictive analytics to match people with the right treatment at the right time. Dr. Adler explained her transdiagnostic approach that looks beyond traditional diagnoses to address the underlying factors affecting each individual's mental health. We also discussed the powerful intersection of technology and mental health care. Dr. Adler shared valuable insights about women's mental health across different stages, particularly highlighting the often overlooked connection between hormonal changes like perimenopause and mental health symptoms. And for those struggling with stress in their daily lives, Dr. Adler offered these practical strategies. 1. Practice rigorous prioritization. Reassess your values on a regular basis and what's most important to you in any given moment. 2. Build daily resilience. Incorporate small, consistent activities like exercise, balanced eating, and social connection. Number 3, and I really love this one, embrace good enough. Give yourself permission to be good enough rather than perfect in various aspects of life. Number 4, cultivate self-compassion. Treat yourself with kindness and understanding when facing challenges. And 5, take preventive measures. Don't wait until you're in crisis to address mental health. Build in small daily practices that support your well-being. As you know, mental health exists on a continuum with natural peaks and valleys. The key is recognizing when normal stress begins to interfere with your values and daily functioning. That's when additional support becomes crucial. If you or a loved one is experiencing emotional distress or suicidal thoughts, the 988 hotline has help available 24 hours a day, 7 days a week, via phone, text, or chat. Thank you for joining us on Beyond the Paper Gown, and if you're interested in learning more about WAVE, you or your employer can download their app or contact them at partners@wavelife.io. I also invite you to check out our website for more resources and information at beyondthepapergown.com. And while you're there, subscribe to our newsletter so you'll stay up to date on our podcast, articles, events, and more. And before you move on today, please subscribe to our podcast on your favorite platform and rate us so more folks can find us. Thank you, and take good care. This episode was produced by Patrick Shambayate and me, and our associate producer is Kyla McMillian.